Honourable Member for Edmonton-Meadowlark, followed by Honourable Member for Cypress, Medicine Hat.
Thank you, Mr. Speaker. I'd like to thank the Honourable Member from Leduc-Beaumont for introducing Bill 201 into the Legislative Assembly. Now, Bill 201 is to add 2 primary cancers to the presumptive list of cancers, so that firefighters may complain and may claim under the workman's compensation if they get these cancers. But the esophageal and testicular cancers. Now, Mr. Speaker, I was just doing a literature research here on the computer. In San Francisco, they did an extensive study. 1 in 3 firefighters either have or have had cancer. These are astronomically alarming rates amongst the population. In fact, lung cancer wasn't the leading cause of cancer amongst firefighters. The usual top cancers around are either lung cancer, usually due to smoking. For men, 1 in 7 men get prostate cancer. There's an alarmingly high rate of all these other cancers, especially amongst firefighters. Now, before I go on, I'd just like to tell you a couple of brief stories just about the interaction I've had with the heroes of our society. Personally, our house had a big fire in Squamish. Recently, Olympics are right there in Vancouver, and nobody was home, and thank God the fire department arrived and put the fire out, saved our home. I was visiting in Boston at a conference years ago and was building my new home. Somebody was sleeping in my home for the weekend, and there was a fire. At 3:30 in the morning, the fire department called and told my family that my home had been put on fire and they had put it out. Recently in Edmonton-Meadowlark, one of the elementary schools had a fire in the summer. And they put the fire out, the school survived, and it's been refurbished, rebuilt, and actually many of the children were introduced today. Now, other things I like to say about these frontline heroes of our society, you have our police officers, our paramedics, our firefighters, and those in the front lines of healthcare. I've had many interactions with them firsthand. In fact, many of them are my friends. We have integrated fire and EMS services in town. It's beyond fire. Anytime there's a 911 call, these are the first responders that are there when there's a car accident. In fact, they get there before the ambulance and police do. I remember being as a STARS doc being called to a scene in Strathcona. It was just like television. This pickup truck was underneath a train. High-speed accident. And these are the people who rip these vehicles apart so that we can do fantastic work with them in the front lines and the emergency departments. They can't get to us healthcare workers until these folks up here put their lives at risk at 35 below weather at 3 in the morning in some strange cold location. And then there's the risks of stepping into a fire at 3 in the morning when you're tired and you're woken up and suddenly you jump into a truck, put your uniform on, and this is a profession that you have to shoot first and think later. You've got to act immediately. You don't have time to think. And they're trained professionals, trained to act accordingly in the right way. And the last thing on their mind usually is their safety. The first thing on their mind is everybody else's safety. So I'd just like to acknowledge the efforts of all our dear friends and heroes out there. You are the best of us. Now, because they react first, they place themselves at the greatest risk. Mr. Speaker, when they come to us in the emergency room, patients are cleaned up and the scene's been secured. When the tornado happens, they place themselves at greatest risk simply because they must. If they don't, there may be 100 school kids that burn down in that school. And this is why part of this legislation, as I said, when I first started as a medical student, I did a ride-along with the paramedics. And geez, I felt really nauseated at the end of the ride because it made me sit backwards. We'd go sit in the fire hall, and these guys would be cooking healthy food all the time, and they would be working out. And I thought, geez, as an ignorant young medical student, I thought, man, these guys got an easy life. But when they're called into action, the reason they got to eat this healthy food, and the reason they have to get their rest and their sleep, and the reason they're working out, because they might be called and they might have to lift a 300-pound man down a stair, so they have to be in fantastic physical shape. In fact, if everybody else did healthcare what these folks do, we would have no problems in the healthcare system. Healthy lifestyles, healthy eating, this is the embodiment of our society. I would just like to say, you know what, Mr. Speaker, we have to endorse this. We can't even think about not endorsing this. Because unfortunately, it's years later when the damaging effects of the poisonous chemicals are known, and the dermal exposure from all these chemicals that these heroes get from the plastics, the dioxin, the carbon monoxide, the cyanide, all the million chemicals, they experience them later on in their life. And the last thing we need to do is ask them to prove to us where they got this from, when really the evidence already exists. Mr. Speaker, I'd like to thank the honourable member for introducing this. I'd like to thank all of my friends up here in the gallery for being here. I'd like to thank all of my friends in the Assembly for speaking positively to this. Thank you.